And we're live.
All right, good morning. This is Senate Health and Welfare, and it is Valentine's Day, February 14th. So there's a little bit of red in the room. I'm trying to see. It's mostly pink, but that's okay. Still Valentine's Day.
Come on,
Yeah, he's red. It's good.
my wife wrestling.
That's good. It's good to have others invested in your work. Right. So this morning we're looking at some bills. We're having an introduction to some bills, but we're also going back and looking at the freestanding birth center bill a little bit, and then we'll have a chance perhaps we'll have a chance for discussion later. The first bill we're looking at is a House bill that just came to us, and we have the chair of House Healthcare here to introduce herself and give us the sort of the broad overview and why the bill is here and why it's important.
Sure. Representative Alyssa Black, Chair of House Healthcare. So H31 is, so Act 111 of 2024 was a bill that we did last year around prior authorizations and claim edits. And I'm not going to get into what a claim edit is. Essentially, just really briefly, when a service happens, the facility sends a claim to an insurance company who then pays the claim, processes, adjudicates the claim, and pays it. So throughout the summer and fall, great working groups have been happening between payers, providers, trying to implement Act 111 as we intended. And through this process, it became clear that there were some things that needed some clarification and some tweaks a little bit. So that is what H31 is. It is the product of a very collaborative process between all interested parties. So that I'll just really quickly touch on the two main pieces of this. When there was a section on processing claims and the claim edit standards that needed to be utilized when processing the claim had to align with Medicare's claim processing standards. It was all about aligning payers to make it easier for payers or providers to know how to code claims. And one of the things that came up, and I will use their name because it's important because they are actually based in New York State, is what happens when a patient who's lived in Vermont receives a service in another state. We'll just say, a neighboring state like New York State. When that claim from that New York facility comes to MVP, do they need to adhere to the claim edit standards that the state of Vermont has said needs to happen? Or do they have to then take that New York claim, run it through a completely different claim edit system and use the Vermont standards on the New York claim? And it is determined that, frankly, we cannot legislate outside of our borders. So Section 1 of the bill essentially says that the claim is only for Vermont providers. That the claim edit standards follow the provider, not the patient. That's what Section 1 does. Section 2, we had a section in Act 111 that exempted prior authorizations on select types of services for primary care providers. At the time we did the bill, well, there is no actual definition of what a primary care provider is in statute. So we used as defined by the Blueprint for Health, because Blueprint for Health has done work on, trying to assign who actually is a provider, what provider types are primary care providers. So there was confusion around whether or not the provider met the definition of Blueprint for Health, or whether the provider needed to be enrolled in the Blueprint for Health. So we have changed that. So the exemption for prior authorizations is for primary care providers who are enrolled with an insurance company, contracted by an insurance company, and have designated themselves with the insurance company that they are a primary care provider. So the insurance companies will take the primary care providers that they have on their roster of credentialed and contracted providers, and those are the providers that would be exempt from prior authorization for the purposes of this bill and Act 111. And then there's effective dates, and that's it. We set the effective date. The claims edit piece actually doesn't go into effect until January 1st of 26 anyways. So we have just set the effective date of this change to that same date to provide clarity. And the primary care provider piece, that went into effect on January 1st of 2025, just a month and a half ago. And because the insurances have already taken the guidance from DFR to use the definition of Blueprint provider, it would be very onerous for them to switch that mid-year. So therefore, the new change will take effect January 1st of 26. And that's the bill.
Good work.
Thank you.
That was very clear and very helpful.
Thank you. And I do want to just add that we moved this quite quickly because it's important to remember that payers are developing their rates for the next year. And they start that rate review very quickly in the beginning of the year for the next year. And they really need clarification and definitions of how they're going to implement this quite quickly. So that's why it's moved so quickly. And I appreciate you taking it up in a really expeditious manner.
It is out of order. I mean, ordinarily we wait till after crossover, but I understand that there's a lot of interest in having this go forward from just everyone in the room. So Senator Cummings, you have a question?
For the sake of honesty, that's no secret that Senator Brock and I tried to have this bill stopped last year if we could get an actuarial assessment. And it's my understanding that we are in danger of losing our second largest health insurer over the cost of our having separate claims editing. Does this bill solve that problem?
This bill does not solve that problem. And I think that you would have to probably hear from the payer on whether or not I'm not commenting.
Yeah, I guess we'll have to hear from the payer, but from my understanding is that this isn't the reason for the
No, separate
solvency.
claims added, yes.
Yeah, not, yeah, so we can ask DFR that question as well. Yeah,
Sure.
so thank you, Representative Black.
Thank you.
Appreciate it. Any other questions for,
What would be vote totals in committee and then passing to
Oh,
the House?
11-0-0, and it was a voice vote, and it was unanimous.
Thank you.
okay.
Sorry, I should have told you that.
Thank you. All right, so Jen, you want to walk us through? And there, Sebastian, you're not, I don't have your name on the agenda, but you are on the agenda.
I'm available for questions.
That's good. That's terrific. Thank you. And we've got everybody else who's here. That's great.
Good morning, Jen Carvey from the Office of Legislative Counsel. I think Representative Black did a great job of telling you what's in here. I will show you the language, but it's going to be pretty easy after that for you to understand what's in. Right, so you should be able to see, this is H 31 as passed by the House, an act relating to claim edit standards and prior authorization requirements. Section 1 is that change that Representative Black described in the section on claims, processing claims and claim edit standards. And as she said, there were some adjustments made to the claim edit standards in last year in Act 111 that required greater alignment with Medicare. Those provisions have not taken effect yet, but will take effect in January 2026. And this adds to the list of circumstances under which adherence to those specified edit standards that are in subsection B, which you can't see in here, but where adherence is not required. And under existing law, that's when necessary to comply with state or federal laws, rules, regulations, or coverage mandates. And for edits that the payer determines are more favorable to providers than the edit standards in subsection B, or to address address new codes not yet incorporated in the software in certain circumstances. This would add that those claims edit standards also are not required when adjudicating claims for healthcare services that were delivered outside the state of Vermont, unless the payer and the out-of-state provider agree that one or more of those edit standards will apply. So in general, we're not imposing Vermont's standards for alignment with Medicare on claims adjudicated, but claims for services delivered out of the state, but the payer and provider could certainly decide together that that's what they would do. Section 2 amends the statute on prior authorization. And as Representative Black said, last year there was language added to require or to prohibit prior authorization requirements for most services ordered by a primary care provider. There are exceptions for prescription drugs and for services delivered out of network. But that's exception here. And then it has the definition of primary care provider. And as she said, if the language as passed last year said it had the same meaning as used by the Vermont Blueprint for Health, that didn't seem to provide sufficient guidance to all parties. So this is being revised to say it means a healthcare provider who is contracted and enrolled with the health plan as a primary care provider. And then the effective dates, section 1 on the claim edit standards will take effect on January 1st, 2026, when those underlying provisions take effect. Section 2 on the definition of primary care provider for prior authorization purposes takes effect on passage and must be implemented by all health plans as soon as reasonably practical after that date, but in no event later than January 1st, 2026. And then the effective date section takes effect on passage.
Questions for Jen? Okay. Thank you. All right. Why don't we just go through our list here? I think, and then we'll ask DFR questions for clarification as needed. I think Senator Cummings already has one. But we'll start with DMS, Jessica Barnard.
Thank you very much. Good morning. Jessica Barnard, the Executive Director of the Vermont Medical Society, representing physicians and PAs. And I think it's fair to say that on the House side, everybody was comfortable and supportive of this bill, sort of the two clarifying pieces. The piece around primary care provider is really why the MS is here, just to put some a little background behind it. Our understanding, and when the bill passed, was really that the intent was to include all primary care providers, and then we had the different interpretations of what it meant, the language in the bill meant. So really, we see this clarification, ideally going back to the original intent of the bill of any primary care provider who participates with a health plan. That the definition that limits it to Blueprint participating providers is about 75% of primary care practices. So it is the majority, but it is not all, and it especially excludes sort of smaller or more independent practices. Some of the practices we really want to help by reducing administrative burden. So it is important to us. We definitely support the expanded definition. And I think that actually moves the intent closer to what passed last year. And we thank you for taking up that piece. We are comfortable also with the piece clarifying around out of state claims. That was a request from the payers, and we were comfortable with that change of definition as well. So, thank you.
Okay. Thank you. Sarah Chicho, welcome.
Thank you. Sarah Chicho with Blue Cross and Blue Shield of Vermont. I did work with everyone over the summer and fall to develop the language in this bill, and we support the changes that are included in there. And especially the effective dates of January 1st, 2026.
We get it. Okay.
Okay.
That resolves that problem.
Yes, thank you.
Good.
Appreciate it.
Okay. Devin, do you want, I know you sent a note in saying, but it would be great if you could testify as well.
Devin Green, Vermont Association of Hospitals and Health Systems. We have worked with the stakeholders. We support this bill.
Wow. Thank you. And then Jordan Esty, is here on the screen. Welcome.
Good morning, Chair Lyons, members of the committee. Can you hear me all right?
Yes, thank you.
Okay, for the record, my name is Jordan Esty. I'm Vice President of Government Affairs at MVP Healthcare and want to formally convey MVP support for this bill. As Representative Black noted at the top of the meeting, the various stakeholders met throughout the summer and fall on implementation of Act 111. And from MVP's perspective, the claims that it changes in the act were very, very complicated. So the added time and discussion was really helpful in establishing clarity around, some of the provisions, some of the questions, some of the challenges we had identified. In particular, Section 1 of the bill answers an open question that, I think as we were working on this last year, none of us really identified, and that was because that change, the claims that it changes are under the insurance law section. Do they apply to the member's benefits? So how do you process a claim if a Vermont-based member is getting services in New York, New Hampshire, or anywhere outside of Vermont borders? And for a small not-for-profit plan like MVP, the complexity and the cost of configuring that type of change was really, really difficult. So you appreciate the conversations, the collaboration with stakeholders and Representative Black and others. And to answer Senator Cummings' question, I think through the DFR regulatory development process, the guidance that was issued at the end of last year, and with some of these clarifying changes in H31, we're feeling much more comfortable with our ability to comply with the law's expectations.
Thank you.
Good, thank you. It's helpful. All right, questions? We're good? Sebastian, are there questions for DFR? Would you like to come up and maybe do you want to have a comment that you could make?
Sure.
Morning, Sebastian Arduengo for the Department of Financial Regulation. The department supports the bill, and we are prepared to take any questions that you might have.
Questions? Wow. Okay.
Yeah.
Got some exercise.
I don't think that chair's warm.
So let's put this one ready to go. And I don't know that I'm ready to go right now, but I think this bill, unless someone has an interest in putting an amendment on this bill or making changes, and I haven't heard that, I would, maybe when we get closer to the end of the meeting, I would look for a motion to move the bill today. It's something I think that if we do it, then as rates are being set, it'll help folks. So, Clerk, you be prepared. All right, so, okay, is that okay with the committee? And I'm thinking that we should do that. And I just want to warn the new guys, this is not the usual process, but this is a bill that's been brought to us with some, I won't say urgency, but some interest in having it move.
Alacrity.
Thank you. I was gonna say, that. She's got it. Okay, with alacrity. Okay, so we're good. All right, thank you. That was great. Well, we could take a break for 15 minutes, and then we could come back. And I might, because our next person to testify is at 10. I'm looking to see Jen, no,